Epstein Barr Virus, or EBV, is incredibly common. In fact, it's estimated that over 90% of the world's population will be infected with EBV at some point in their lives. This virus is part of the herpes virus family, specifically known as human herpes virus 4. It's a virus that has been around for a long time and has adapted to coexist with humans. Most people will contract this virus at some point in their lives, often during childhood or adolescence. The virus spreads primarily through bodily fluids, especially saliva. This is why it's sometimes called the kissing disease. But don't be fooled by the nickname. You can also get it through sharing drinks, utensils, or even from a cough or sneeze. It's part of the herpes virus family, specifically known as human herpes virus 4. This family of viruses is known for their ability to remain dormant in the body and reactivate later. EBV is no different. Once you're infected, the virus stays with you for life. EBV is perhaps best known for causing infectious mononucleosis, or mono. Mono is characterized by symptoms like extreme fatigue, fever, sore throat, and swollen lymph nodes. It's particularly prevalent among teenagers and young adults, likely due to their close social interactions. This illness is particularly prevalent among teenagers and young adults. College campuses, for instance, are common places where mono outbreaks can occur. The close quarters and frequent social interactions make it easy for the virus to spread. Once you have EBV, it stays in your body forever. The virus goes into a dormant state, hiding in your body's immune cells. Most of the time, it doesn't cause any problems, and you might even forget that you have it. Don't worry though, it typically stays dormant, meaning it doesn't cause any problems. Your immune system keeps it in check, preventing it from reactivating and causing symptoms. However, there are times when the virus can reactivate. This can happen if your immune system is weakened, perhaps due to stress, illness, or other factors. When the virus reactivates, it can cause symptoms similar to the initial infection. When this happens, you might experience symptoms again. These can include fatigue, fever, and swollen lymph nodes. It's like a reminder that the virus is still there, lurking in the background. Think of it like a sleeping bear. Most of the time, the bear is asleep in its cave, not bothering anyone. But if something disturbs the bear, it can wake up and become active. Most of the time, the bear is asleep in its cave. You might not even know it's there, just like the dormant EBV in your body. You might not even know it's there. But if something disturbs the bear, it can wake up. Similarly, if something triggers the virus, it can reactivate and cause symptoms. But if something disturbs the bear, it can wake up. This is why it's important to maintain a healthy lifestyle and manage stress, to keep the virus in its dormant state. EBV is something we all need to understand. By knowing how it spreads, what symptoms to look out for, and how to manage it, we can better protect ourselves and those around us. Knowing the facts can help us stay healthy and manage the virus effectively. Awareness and education are key in dealing with EBV, ensuring that we can lead healthy, active lives despite its presence. EBV spreads primarily through saliva. This is why it's often called the kissing disease. Sharing drinks, utensils, or even a toothbrush can transmit the virus. It's important to remember that EBV can spread even before symptoms appear. This incubation period, about 4 to 6 weeks, means someone could be contagious without realizing it. While saliva is the main culprit, EBV can also spread through other bodily fluids. This includes blood and semen. However, transmission through these fluids is less common. EBV symptoms can vary from person to person. Some people experience no symptoms at all, especially young children. Others might have mild symptoms that resemble a common cold. The classic symptoms of EBV, particularly in teenagers, include fatigue. This is often extreme and can last for several weeks or even months. Fever temperatures can range from low grade to high. Sore throat. This can be quite severe and make swallowing difficult. Swollen lymph nodes. You might notice lumps in your neck, armpits, or groin. Other symptoms can include headache, body aches, rash, loss of appetite, and an enlarged spleen or liver. Diagnosing EBV starts with a visit to your doctor. They'll ask about your symptoms and medical history. A physical exam will help them check for swollen lymph nodes, an enlarged spleen, or other signs. Blood tests are usually needed to confirm the diagnosis. These tests look for specific antibodies that your body produces in response to EBV infection. Sometimes EBV can be mistaken for other illnesses like strep throat or cytomegalovirus (CMV) infection. Blood tests can help differentiate between these conditions. Section 5. Treatment options for EBV. There's no specific cure for EBV, also known as the Epstein Barr virus. This virus is a member of the herpes virus family and is one of the most common human viruses. It spreads primarily through bodily fluids, especially saliva. Antibiotics don't work against viruses, including EBV, because they are designed to combat bacterial infections. Therefore, the focus of treatment is on alleviating symptoms and supporting the immune system. Treatment focuses on managing your symptoms and supporting your immune system so it can fight off the virus. Rest is crucial. Getting plenty of sleep and taking it easy can help your body recover more effectively. Your body needs time to recover. Gentle activities like meditation, yoga, or a leisurely walk can be beneficial, but it's important not to overdo it. Avoid strenuous activities, especially if you have an enlarged spleen. Engaging in heavy exercise or lifting heavy objects can be dangerous during this time. Overexertion can increase the risk of a ruptured spleen, which is a medical emergency. If you experience severe pain in your upper left abdomen, seek medical attention immediately. Stay hydrated by drinking plenty of fluids. Hydration is key to helping your body function properly and can aid in your recovery process. Water is best, but you can also have clear broth, sports drinks, or diluted juice. These fluids can help replenish electrolytes and keep you hydrated. Avoid caffeine and alcohol as they can dehydrate you. Caffeine can also interfere with your sleep, which is essential for recovery. Over-the-counter pain relievers like acetaminophen or paracetamol can help reduce fever and relieve pain. These medications can make you more comfortable as your body fights the virus. However, avoid giving aspirin to children as it's been linked to a rare but serious condition called Reyes syndrome. Always consult with a healthcare provider before giving any medication to children. Section 6. Potential complications. While most people recover from EBV without any issues, complications can occur. An enlarged spleen is a common concern. This organ can become so swollen that it's at risk of rupturing. A ruptured spleen is a life-threatening condition that requires immediate medical attention. In rare cases, EBV can lead to more serious complications. Meningitis, which is inflammation of the membrane surrounding the brain and spinal cord. Encephalitis, which is inflammation of the brain. And airway obstruction, where swollen tonsils can make breathing difficult. Section 7. Long-term effects and associations. EBV establishes a lifelong, latent infection in your body. This means the virus remains dormant but can reactivate periodically. Most reactivations are asymptomatic, meaning you don't experience any symptoms. There's a debated link between EBV and chronic fatigue syndrome, or CFS. Some people with CFS report a previous mono-infection. However, more research is needed to establish a definitive connection. EBV has also been associated with an increased risk of certain cancers. Burkitt lymphoma, a fast-growing cancer of the lymphatic system. Hodgkin lymphoma, another type of lymphoma that affects the lymphatic system. And nasopharyngeal carcinoma, a cancer that occurs in the nasopharynx, the area at the back of the nose. Section 8. Prevention strategies. Currently, there is no vaccine to prevent EBV infection. However, you can take steps to lower your risk of contracting or spreading the virus. Good hygiene is paramount. Wash your hands frequently with soap and water, especially after using the restroom, before eating, and after being in public places. Avoid sharing personal items that come into contact with saliva, such as utensils, drinks, toothbrushes, and lip balms. If you're sick, stay home to avoid spreading the virus to others. Cover your mouth and nose when you cough or sneeze and discard used tissues properly. Section 9. Future research and conclusion. Scientists are actively researching EBV to develop better treatments and prevention strategies. This research is crucial as it aims to understand the virus's behavior, its interaction with the human immune system, and the long-term effects it can have on health. One area of focus is the development of an EBV vaccine. A successful vaccine could be a game changer, potentially saving millions from the debilitating effects of the virus. Researchers are conducting various trials to ensure the vaccine's efficacy and safety. A vaccine could potentially prevent infection altogether or reduce the severity of symptoms. This would be particularly beneficial for those who are at higher risk, such as individuals with weakened immune systems, or those with a family history of EBV-related complications. Researchers are also exploring new antiviral drugs that could target EBV and stop it from replicating. These drugs could offer a lifeline to those who suffer from chronic active EBV infection, providing them with a better quality of life. These drugs could be particularly helpful for people with chronic active EBV infection or those at risk of EBV-related complications. The development of these treatments is a complex process that involves understanding the virus at a molecular level. As we learn more about EBV, we can make better decisions about our health. Public awareness and education are key components in this fight, helping people recognize symptoms early and seek appropriate medical advice. By understanding how the virus spreads, recognizing the symptoms, and taking preventive measures, we can minimize its impact on our lives. Simple actions like maintaining good hygiene, avoiding close contact with infected individuals, and staying informed can make a significant difference. If you have any concerns about EBV, don't hesitate to talk to your doctor. Medical professionals can provide personalized advice and recommend the best course of action based on your individual health needs. Staying proactive and informed is the best way to protect yourself and your loved ones.